More Americans are now living below the poverty line.
Now we're seeing people losing their jobs, their homes.
50 years old and unemployed, she does not have access to health insurance.
It's really by the grace of God that we get by each month.
She spends half her monthly fixed income just on prescription drugs.
They're working and they don't have health insurance, and they can't afford to buy health insurance.
We knew what we wanted to do. We knew that we wanted to help those who were falling through the cracks and who were showing up at ERs very, very ill.
So we thought, gosh, is there enough community interest in this project? And out of that developed the clinic concept.
Like many success stories in the world, the clinic began as an idea, a simple idea to solve a complex community problem in McLean County. When the discussions began almost 22 years ago to address local emergency rooms being filled with patients who lacked insurance, no one could have imagined how clinic services would evolve into what they are today. This grassroots, local solution to a local problem created our mission that still guides us today. That mission is providing high-quality medical care to the underserved of McLean County through the operation of a free medical clinic.
There was this gap of people who were underinsured or were between insurances, and how could we address the needs of those populations. My background had been in the emergency department for many years at St. Joseph, so I had seen a lot of those patients coming through for treatment because they had nowhere else to get it.
I had been to a healthcare clinic that the Presbyterian Church was involved with on the border between Juarez, Mexico and El Paso, Texas, and I had been very interested in their free clinic and some of the work that they were doing, and I was getting more and more a sense that even though Bloomington Normal and McLean County has had a rich heritage and have great social services, I was concerned about people who were falling through the cracks.
The McLean County Medical Society 22, 23 years ago looked at what was going on in our community and the access to care for population within the community who didn't have third-party payment mechanisms or third-party payment capability.
The working poor, the people who are doing everything they can, working 3 different jobs, and at minimum wage, whatever minimum wage is this week, it's not necessarily enough to feed a family of 4 real well and to pay for health insurance. The working poor need some place to go.
It was really the patients with the chronic diseases, the diabetes, the heart failure, that there was just really no net to capture those patients in and get them into a good treatment program. They had no money to get their medications.
We thought about how we could do this. There were some models out within the community, within the state, and Bob Reardon, who was then the president of the Illinois State Medical Society, challenged the executive committee of McLean County Medical Society to come up with some sort of plan.
I can remember an early meeting with John Kruger and Paul Peterson and Sue Clark saying, yeah, we need to get this going for adults now. Made a lot of sense. The prenatal clinic was originally a partnership between OSF and Bromen, and logical that they would step in and be partners along with the adult clinic.
The Medical Society sort of came up with the concept, and they were looking for people, and there was a community meeting, and Paul Peterson ran that, and then he just asked for volunteers, and I don't know whether he told me I was going to volunteer or he was kind of suggesting that I should. And then there was another guy there who, so I was waiting to raise my hand, and then another guy quickly threw his arm up. His name was Al Shepston, and I had known Al because he'd been a television personality. He'd been on one of the Peoria stations, I think, as a sportscaster. And so we started off on the steering committee. Where do we go from here?
I just remember hearing about it. I was active in the Nurses Association at the district and the state level at that time. and just felt like it was something that nursing needed to be involved in. And then when I came to the meetings and looked at the data, it just became very apparent that that we needed to get this done, and I really wanted to work with the clinic.
We had a community meeting down at the Bloomington Public Library, and there was a bunch of people who came. There was a lot of giving people in that meeting, a lot of folks interested in how we survive and work as a community. And out of that came a whole bunch of work. The initial steering committee, developing bylaws and developing process, developing people. Then that developed into a board. And that board then progressed in how we would go about marketing the community clinic, how we would go about getting patients, who we would serve, and it's progressed from there. If Bloomington Normal can't take care of its own, what community can?
If it wasn't for the community healthcare clinic, I wouldn't be able to get my insulin for my diabetes.
Even though I work, I rely on the community healthcare clinic for my healthcare needs.
If it wasn't for the community healthcare clinic, I would not get the care that I need.
What began as a twice-weekly evening volunteer clinic has evolved into a patient-centered medical home that prioritizes patient needs and is focused on the provider-patient relationship. Throughout our 20-year history, our true success is the trusting, compassionate relationship we create with our patients.
Our motive was, how can we help people get care early? How can we prevent people coming into the hospital emergency rooms at a crisis stage, at a late stage, when they were more at risk, and also the cost of care was higher. I guess what I'm most proud about the community healthcare clinic is that it is a local initiative done by local people to serve local people. And I miss that in our world today. I think looking back, I'm just very thankful that we were able to come together as a community to figure out a way to do something better and to get better results to those who really needed the service and the help.
We agreed to see patients and treat patients for their cardiac problems. And over the years, because of the nature of what we do, we've had some very complicated people who've required caths and bypass surgery and stents and defibrillators and chronic blood thinners for their artificial valves, whether it's labs, x-rays, invasive, non-invasive tests, surgical procedures. So I don't know the dollar amounts, but I know it's been in the millions of dollars over the years, and I think that's a great gift from the hospitals to the community.
We did have advanced practice nurses early on, and when we hired Allison Watkins as the executive director, she was a nurse practitioner, so she could not only hold the executive director position, but also provided patient care. You know, establishing the pharmacy, Ann Culleton did that, another nurse, and she did a fabulous job. We had, getting the medications stocked and being in line with all the laws that are out there and what have you. Getting the volunteers, there was a lot of excitement.
Hypertension, diabetes, these kind of things people would die from. They did not live long lives. And so when we first got involved with thinking about what's this clinic going to be like, I think one of the things that we didn't know was how much people were suffering from chronic illnesses that were going untreated.
Soon after I came to town in 1994, I actually started working at the clinic itself when we opened up the pediatric clinic. My first 2 clinic patients were a 4- and 6-year-old sister pair. They were very darling, but they had a lot of vim and vigor going for them. Over the course of the year, I think I saw them, 6 to 8 times for various ailments. They grew up and left the clinic. Didn't see them for a while, but just about 6 months ago actually ran into their mother, who became a patient of mine. And the oldest daughter is getting ready to have her first child and was asked to be remembered to me for the times that we spent in the clinic. And it was very heartwarming for them to remember me, and that was nice.
And we were just struggling to get it so we had enough stethoscopes to listen to pulses, and who had which equipment that we needed, because we were sharing the clinic with the prenatal clinic, and all the hazards that went along with that. It was fun. I think one of my most proudest moments was we hired nurse practitioner Sue McGinnis right out of her nurse practitioner program. We needed a nurse practitioner, and we hired Sue, and I'm just delighted she's still there.
The clinic has grown considerably since I first came in 1998. Back then, we shared the building with the prenatal clinic, and so we only had half the space, number one, and had to share exam room time, so we just flat out couldn't see as many patients. And staff-wise, we had an executive director, the clinic nurse, and me. And all of the rest of our staff at that point were volunteer staff. Just the sheer number of patients that we're dealing with, of course, has significantly increased. Now we're really blessed to be able to have 3 part-time nurse practitioners that are also assisting. What's been constant, of course, is the physician involvement and being able to have physician volunteers come in and see patients as well.
And the clinic has really good people. I really appreciate the nurse practitioners there, and they're out there on their own, and there's a lot of orthopedic problems that are really difficult to analyze and difficult to interpret, and I am more than willing to be able to help them. I also will field many calls from Mike and the nurse practitioners, and so there's a lot of communication. I get to go in there, I get to see them, and they tell me thank you, and yet it's Mike and Laura and everybody behind the scenes that have done all the work.
I was interested in coming to the clinic because it offered a whole new experience for me. I had not had any exposure to the Hispanic population. I had had a little exposure to the homeless, but not a lot, and I just felt it was a population that I would like to serve.
He just loved the place once he got in here. It was a challenge at that point to set up the pharmacy. He liked the idea of it, and he loved all the people he worked with. He looked forward to coming. I do know that he did recommend people to come here, and then he would, there was one in particular, he would run into her in she worked in a restaurant, and he followed her until he was sure she got in here and got enrolled and was taken care of. It was very hard for him to give it up, probably about 2 years before he passed away. And he'd have kept coming. That was hard for him to give this up. To him, it was a combination of doing something good and his profession.
None of the clinic's accomplishments could be achieved if not for the community's support. From hospital services and volunteer subspecialists to nursing students and front office support, the clinic relies on this unique infrastructure to keep overhead expenses low and patient care very high.
These were patients that we were already taking care of, one way or another, oftentimes through the emergency department, sometimes appropriately so and sometimes unnecessarily so. But by and large, we were already taking care of this group of patients. And so this was an opportunity. This was an opportunity to try something new and to give these individuals what today we would call a medical home.
Another factor I think that was always on our minds was how we would engage the medical community, how we would get the physicians, the nurses, and whoever to help support this. And I didn't think we worried about that because the physicians in the community are also interested and desirous of giving back to the community. So I think the concept was one that was universally acceptable and actually desirable.
Probably what sticks out more importantly is the physicians who come to the clinic and donate time. Everybody comes and says, this is what I got into medicine for. I'm giving the care that I've been trained to give, and it's been a pleasure for me to do so.
Both hospitals have been involved from the inception, and I am so proud of my hometown because both hospitals continue to see our patients for free. They provide an incredible number of services for our patients without really batting much of an eye, even though the volume and, again, the complexity and the costs of what our patients are needing has significantly grown.
They need continuity of care. We hope to provide that by having a constant stream of doctors coming in, volunteering their time. The reason we do it is because it's the thing to do. Folks need help. We went into medicine to help people, and hopefully we're making a difference in people's lives and helping at a time when they need it the most.
Going in to see a patient, whether it's for blood pressure or infection, you can go to the in-house dispensary and pick up medications, both branded, which the drug companies donate, and meds that you have huge samples of, and dispense those, give them little packets on their way out, and they don't have to go to the pharmacy. I love volunteering at the clinic. I get out of it a sense of helping. You know, some days, again at Medical Hills, you get bogged down in the paperwork, the drug denials, the referral denials, and that the patient care sometimes gets a little bit lost. But at the clinic, it's just purely talking with the patients, helping meet their needs, answering questions, and a very pure doctor-patient experience.
Well, usually the patients I see at the clinic are kind of the difficult people that aren't able to get back to work, and there's a problem that they can't that's orthopedically related. An example might be that a young kid has a torn piece of cartilage in his knee and it's trapped in the knee, and there's no therapy that's going to help that. The only thing that's going to help that is to arthroscope the knee and clean that out. Or the lady who has the trigger thumb, and she's working in the bakery and it hurts every time she moves it, and it's really disabling, but it's a very simple operation that you can do on it and markedly help them. And if I'm able to get that person back to work, there's a huge reward out of it. You know, I enjoy the caring and I enjoy the commitment, but I just enjoy the people, and I really enjoy that person that I'm able to get back to work and says thank you.
I think one of the best things the clinic has done is to assign the patients from the clinic to one of the hospitals on a permanent basis, because that's developing. I think healthcare is about having relationships and ongoing, continuing relationships, and having that type of relationships with those patient populations. We're going to be able to work as partners with the clinic and do true health care and preventative health.
My experience with the community clinic patients has always been, for the vast majority, that they're really nice people. You know, they may just be in an unfortunate circumstance at this point in their life. Some of them have, you know, gone back to work full time and acquired insurances, and it's just always nice to be able to give back, because you always do receive more in terms of satisfaction and just a feeling of really participating in the community as a whole.
You know, in my position now, I get to work and talk to a lot of people, and there are a lot of free clinics in this state, but not all of them have had the cooperation of the hospitals that we have had in this community.
For me, it's a real joy to be able to have an impact on somebody who otherwise may not be taken care of. We're all helping patients every day. Some of our patients, like some of the community care patients, it's easier to see the improvements that you're able to help.
I'm very pleased to see how the clinic has evolved in the number of patients that are being served today and will continue to be served at the clinic. The need is certainly there. And to hear the testimonials of patients who have been served by the clinic and what it has meant to them, to have a space to go, as opposed to the emergency room. They have a doctor's office. The clinic is their place to have care provided.
Illinois Wesleyan's partnership with the Community Healthcare Clinic enhances our curricular offerings. We have many students who provide translation for Hispanic clients, and the experience they have with the nurses at the clinic has really propelled them into a professional nursing role.
I started volunteering at the clinic in summer times, and so actually a student told me about it and said, you know, there's a growing need over there, and I thought, oh, let me go check this out. I was there for a couple summers, great dynamic at the clinic, and I thought, wow, this is a nice opportunity for a possible class. And at the same time, the School of Nursing at Illinois Wesleyan was looking to develop Spanish-speaking opportunities for their students. So we created this course, Medical Spanish and Cultural Competency for Healthcare, and that started, I think, in 2003. I've been teaching this class, like I said, for over 10 years, and every year the students say the same things, how welcoming the people who work at the clinic are, how much they do for the community, and what a wonderful opportunity it is for the students, and then, of course, the service provided to our community.
I saw the clinic grow from a handful of patients to hundreds and hundreds of patients. Saw the staff grow. Saw basically very few policies in place to a whole bunch of policies, good policies that would make the clinic a healthier place and a more productive place as well. They asked me if I'd be willing to join the board, and they asked and I said yes. Love the mission. There are just so many broken people in our community, and just the desire to be able to help them with their physical needs. I'm kind of on the side of helping people with their spiritual needs, and the clinic just fit right into that. Saw fundraising grow significantly. Saw an enormous amount of grants come through.
It was 2002 when I knew that I wanted to get involved in my community a little bit more. I just happened to see in our church bulletin that there was a need for volunteers at the Community Healthcare Clinic. I truly love the dedication and perseverance and kind and generous nature of all of the staff. They are just such a wonderful group of individuals that really band together to do the best for our patients. It's working with the patients, which I really enjoy.
We had a number of volunteers that came in quietly, unassuming, took a role in, especially I remember working with our meds for the pharmacy and sorting those and getting those organized. Frankly, this is not a very deep funded program. We really depend on the community in many ways to make contributions to keep the clinic going. And if it were not for the volunteers, if we had to hire all the people that did the tasks that they do, it would be a much more costly operation. You know, the clinic, and the whole community for that matter, is blessed with wonderful volunteers. I guess I'd like to use this opportunity to say thanks to all the people that do that.
The framework that was established by our early leaders has allowed healthy growth and expansion since those first evening clinics. From serving 700 patients that first year to becoming a medical home to almost 2,800 current clinic patients, we remain committed to ensuring everyone in our community has access to quality health care. And for that, we are forever thankful. To every steering committee member, every board member, every volunteer, every community partner, every staff member, and every donor who has invested in the clinic, we thank you. Thank you for making McLean County a healthier community for us all.